With healthcare costs on the rise, millions of Americans are turning to individual and family plans to access the coverage they need. But what exactly are these plans? And how can they benefit you and your family? Well, joining us now to discuss from United Healthcare is Andrea Crystals. Thank you so much for waking up with us. I really appreciate your time.
Thanks for having me, Maggie.
So it gets kind of complicated. What are individual and family plans and who qualifies exactly?
Thanks for that question. We get that a lot.
Yeah.
So individual and family plans are really designed for anyone who's underinsured or needs coverage. So someone who doesn't yet qualify for Medicare, maybe they retired early, they haven't hit that magic age of 65, or maybe it's someone who's self-employed, a salon owner, a restaurant owner, and their entire staff that may or may not have access to quality, affordable coverage.
So what are some of the key benefits people can access through these plans?
Great question. So lots of benefits are baked into these plans automatically. Things like prenatal care. We want to make sure that healthy babies are being born. If you need surgery, hospitalization, doctor's visits, preventive care, that's really table stakes. We want to make sure that everyone has access to those services. But there's a number of other benefits that United Healthcare chooses to include in these plans. This is things like fitness memberships. If somebody wants to go to the gym or they want to have a digital fitness membership, they have options for that. Also having things like vision and dental included in the plans, and lower no-cost urgent care visits. I know myself, you were just mentioning all the kids and the ghouls and goblins that were out last night. My kids are magic, and they're able to get sick at 5:01 p.m. on a Friday without fail. As soon as the pediatrician's office closes, that's when they're going to spike a fever, roll an ankle, and will need access to care right away. So having that digital urgent care visit is so helpful for us to be able to talk to a primary care physician or talk to an urgent care facility and make sure they're getting access to care right away.
I thought my daughter was the only one that was magic with that. And Roseola, that haunted us last year right at Thanksgiving. So I'm with you, my friend.
Yeah.
Here's the thing, too.
Yep, absolutely.
Yeah, I think we've all been through it. Affordability. Everything is so expensive. So can you talk to us a little bit about how we can get a plan that is a little bit more affordable?
Absolutely. These are affordable care plans, after all. Plans in healthcare should be affordable for the average family. There is no reason why someone should ever have to make the choice between groceries and prescription medication. In fact, over 90% of our members in our plans pay less than $10 a month, and over half of them pay $0 a month for access to healthcare. So the plans are very, very affordable. Just finding out whether or not you qualify and what's available for you in your market is the hardest part.
Well, you have made me feel a lot better about this because I get really overwhelmed. Where can we go for more information and also to get in touch with somebody in case we need more help?
Absolutely. Our team at United Healthcare is here to serve and help whatever that looks like for people to navigate the complexities of the healthcare landscape. The first place to go is uhc.com/exchange. You can type in your zip code, take a look at those plans, and talk to our teams directly to help you navigate the complexities of the healthcare landscape.
Well, thank you so much for your time. I really appreciate you.